Hello, everyone, and thank you for being present. I want to begin my presentation in a manner similar to that of Shawnee Benton Gibson in her TEDx talk, Words and Wombs. I begin by honoring and acknowledging the womb that carried me, and I encourage you to acknowledge the womb that carried you and all the wombs that came before. Hello, everyone, and thank you for being present. I want to begin my presentation in a manner similar to that of Shawnee Benton Gibson in her TEDx talk, Words and Wombs. So I begin by honoring and acknowledging the womb that carried me, and I encourage you to acknowledge the womb that carried you and all the wombs that came before. For God's creation comes through the womb. This presentation will explore the impact of the horrors of American slavery on Black maternal health today. My intention is to educate on the impact of the exploitation of enslaved African and Black bodies on our present, the structural racism in the American gynecological medical system, which is the root of our current Black maternal health crisis. In the end, I will provide potential spaces for solutions and advocacy. Queen Afua is a holistic health coach who focuses on assisting women of color with restoring womb health and learning to care for their womb by incorporating ancestral practices. This quote is significant because before I dive into Black maternal health, I first must begin with reproductive trauma. Reproductive trauma and crisis for women includes life-altering experiences related to wanted or unwanted pregnancy, menstrual health, STI, reproductive system disorders, impaired pregnancy health, menopause, sexual abuse, and sexual violence. In addition to the emotional and psychological toll, reproductive trauma contributes to the disempowerment of women and a loss of control of their bodies. Recent research by the Center Against Violence has explored the complex relationship between the mental and emotional distress caused by sexual abuse and its potential consequences on reproductive health. This includes the startling statistic that victims of child sexual abuse are twice as likely to experience infertility. This connection arises from the intense mental and emotional turmoil endured during sexual abuse, which can have physical manifestations when attempting to conceive. For survivors, pregnancy can be triggering, resurfacing difficult memories. Furthermore, sexual abuse can lead to reproductive disorders with a heightened risk of endometriosis and accelerated ovarian follicle loss in women who experienced abuse at a young age. This image demonstrates the emotional impact of the silent suffering of women with reproductive trauma. Unfortunately, for many, this baggage is unconscious. Many of us do not have the emotional language to express what we are experiencing. Therefore, we carry it with us in our subconscious and unconscious, not knowing that they are having a tremendous impact on our ability to enjoy our life, as well as have a healthy physiology. These profound experiences lie in our unconscious and perpetuate the trauma cycle. We are the heirs of trauma, and we are producing future heirs of trauma unless we begin to break the cycle. In addition to the emotional burden of reproductive trauma, Black women have the combined experience of the physiological stress of being Black in America. Although Black women live longer lives now, the effects of racism have reverberated. Since 1994, maternal mortality has dropped by almost 50% worldwide. Yet between 2000 and 2013, high Black maternal death rates placed the United States second worst in maternal mortality among nations that participate in the Organization for Economic Cooperation and Development. The United States placed second out of 31 nations. In the United States, pregnancy-related mortality is 3 to 4 times higher among Black women than among white women. Even in 2024, the pregnancy-related mortality rate for African American women is closely equivalent to that of enslaved African women. Distressingly, although infant death rates overall have plummeted since the 19th century, the disparity between Black and white infant deaths today is actually greater than it was under antebellum slavery. The cause of these statistics has been profound and found to be structural racism within the American medical system. In addition to the information on this slide, women have a higher risk of receiving a PTSD diagnosis than men. Recent research has shown a link between traumatic experiences and the reproductive life cycle in women. Women with a history of abuse or trauma may experience reemergence of symptoms during pregnancy. Lastly, women who experience miscarriage may present with even higher prevalence rates of post-traumatic stress disorder symptoms. Women who struggle with conditions such as endometriosis and infertility have a lower quality of life than other women. Infertile women report a high prevalence of anxiety and depression, with many also reporting experiences of suicidal thoughts or behaviors. So how does this all happen? How do we get here with these devastating statistics? Well, again, research has demonstrated that this is due to structural racism and implicit bias within the medical system, as well as the epigenetics of ancestral trauma. Biases and structural racism within the medical system are perpetuated in the lack of multicultural education healthcare workers receive as a part of the learning and training experience. In my own personal work as a healthcare professional, I have witnessed the impact of systemic oppression via a disparity in healthcare outcomes and treatment received while in the care of medical professionals when you compare white persons to non-white persons. The American medical profession was entangled in the institution of slavery from its beginnings. From the earliest origins of chattel slavery in North America, Europeans with medical training served the interest of slave owners rather than enslaved patients. The impact of racialized science on the field of medicine today is painfully illustrated by the deep linkages that American gynecology has with slavery. Many of the field's most pioneering surgical techniques were developed on the sick bodies of enslaved women who were experimented on until they were either cured or died. A slaveholding surgeon, Francois Marie Provost, pioneered cesarean section surgeries on American enslaved women's bodies through repeated experimentation. James Marion Sims, another quote unquote famed 19th century gynecologist, created the surgical technique that repaired obstetrical fistula by experimenting on a group of Alabama enslaved women. To add a historical context, the same James Marion Sims, aka the father of gynecology and medical experimenter of Black women's bodies, was the originator of the quote unquote strong Black woman myth by not providing anesthetic while performing said experiments. This is a continued medical practice today in which Black women are not sufficiently provided pain medication to that of their white counterparts. That gynecology advanced from American slavery means that Black people have always had a precarious relationship to the field and its practitioners. How does a community learn to trust doctors whose forefathers were interested only in repairing and restoring Black women's bodies' reproductive health so that slavery could be perpetuated? How can doctors learn to be more sensitive to the concerns, both personal and cultural, of Black people who still hold secrets about the forced sterilizations that older Southern members of their families endured? How does the medical profession unlearn a pattern of dismissing Black women's self-reported pain when the pattern is rooted in centuries old soil? Traumatic experiences impact our entire being, as well as create an environment that supports genetic modification. Simply stated, deeply painful experiences perceived by an individual as traumatic impacts the health of that individual and can be biologically passed down to the next generation. This is a very basic breakdown of research made available through the study of epigenetics. Intergenerational trauma is developmental trauma that is passed down through the generations. Intergenerational trauma enables a traumatic event to affect not only the person who experiences it, but also others to whom the impact is passed down through generations. This transmission can happen in several ways through caregiving, genetics, and culture. Attachment theory teaches us that the intergenerational transmission of attachment patterns is very real. And that means that if we aren't actively pursuing a different path, we will show up in many of our relationships with the same patterns as our parents or caregivers. The way our primary caregivers were attuned to our needs is what helps us learn how to emotionally regulate our nervous system. A lack of the necessary attunement and attachment during our pre-verbal development can contribute significantly to experiencing problems such as ADHD, anxiety, depression, impulsive behaviors, and other mental illnesses. Additional way to explain how our experiences impact our physiology is to consider the quote by Rene Descartes: "The body is an extension of the mind." Our thoughts and unresolved psychological and emotional pain create inflammatory conditions in the body which lead to disease. As cellular biologist Bruce Lipton notes, you are either feeding the good cells or feeding the bad cells. When we reinforce the impact of these unconscious struggles with a poor diet, we are contributing to the potential development of chronic health conditions and certain cancers. I found it profound that the womb is located in the emotional center of the body, the sacral chakra. I also find it profound that we have a conscious awareness of the importance of managing the mother's nutrition, rest, and stress level for successful delivery. However, we do not consider the genetic impact historical trauma has on future generations until now. Two people I want to mention are Mark Wolin and Rachel Yehuda. They are both psychotherapists who have studied the impact of ancestral trauma through epigenetics. So here we have a breakdown of generational trauma and its impact on subsequent generations. Trauma experienced during the developmental stages of childhood we call developmental trauma. And the reason being is it alters the development of that child's nervous system, which can result in diagnoses of eczema, ADHD, anxiety, ADD, personality disorders, and many other illnesses. Traumatic experiences impact our entire being, as well as, like I said before, creating an environment that supports genetic modification. So I mentioned Mark Wolin and Rachel Yehuda just a minute ago. Mark Wolin is a psychotherapist and director of the Family Constellation Institute. He has been researching the topic of inherited family trauma extensively. And in his book, It Didn't Start With You: How Inherited Family Trauma Shapes Who We Are and How to End the Cycle, he provides numerous case studies from his clients to illustrate how inherited family trauma can manifest in different ways, including shocking anxiety, depression, addiction, and physical ailments. Research by Rachel Yehuda is significant because her research focuses on the epigenetic impact of the Holocaust. And she was able to determine that Holocaust offspring, whose mothers or both parents had PTSD, also experienced symptoms that mirrored those of the parents. When only the paternal PTSD was present, there were less epigenetic changes present in the Holocaust offspring. But when there was maternal PTSD present, there was almost always epigenetic changes present in the Holocaust offspring. Because of further limitations now legally enforced upon women's bodies, we have to develop new methods of survival via what we are calling the new Underground Railroad. The organizations listed here provide pathways to resistance and continued generational trauma through current day healing. These pathways include education through community organizations, policy change, Black women's circles, organizations that train doulas, and childbirth educators and advocacy groups designed to reduce the Black maternal health crisis. And my personal call to action, I have created a nonprofit called God is Woman. And the purpose of this was to help restore women's sense of self, purpose, support, and find a connection, a sense of value and self-worth, specifically for Black women who are suffering with the impact of reproductive trauma, but for any woman who is suffering from reproductive trauma. The goal is to help build community, help women know that they are not alone in their suffering, and help them find a new life or redefine their life's purpose. So this is a project that is still in development, but I encourage you to just occasionally log in or stay connected with me through my website or Instagram to continue to get updates on this project. And I hope you found my presentation informative. I hope that it has encouraged you to explore the impact of ancestral trauma in your own life. And I hope it has helped encourage you to consider the perspective of the womb that you came from. What were the struggles that she may have been dealing with that may have impacted how she raised you, how she was in your relationship? And if you are a woman who is personally struggling with reproductive trauma, I especially encourage you to reach out. If you feel that you need counseling support, please reach out to me or some other therapist. And please stay tuned for the development of the peer support network and women's circles, women's retreats, workshops, just to kind of help women gain a deeper, more intimate relationship with themselves, find restoration and healing in ancestral practices, and unification with their community. Thank you.